Good evening. I'm Dwight Brothers with the BUNS News Network. Today, for our Medline First Report, we will be discussing the topic of fasting before surgery. Traditional beliefs have led physicians to prescribe healthy adults coming in for an elective surgery a period of up to 8 hours of fasting prior to a surgical procedure. Often they'll make it easy and will tell that patient just to not eat or drink anything after midnight the night before the procedure. But what's really the goal of this fasting, and why are patients spending so much time without any food or water? According to physicians, the goal of this fasting is to reduce the volume and acidity of the stomach contents leading up to this procedure. That reduction should reduce the risk of aspiration, which could lead to further complications such as aspiration pneumonia, respiratory disabilities, or other potentially life-threatening respiratory complications. But that all begs the question, is that 8-hour period of fasting before surgery really necessary? A 2003 review by the Cochrane Collaboration challenged those traditional beliefs, and they don't really think so. They have published more recent guidelines recommending a change in procedure from this traditional fasting policy that starts at midnight. The new recommendations present a more relaxed approach to surgical preparations, and this allows the patient to drink certain fluids up to a few hours prior to the procedure. We have a couple experts here tonight that are going to shed a little bit more light on the topic. So let's send it over to Dominic Chiselka and Wesley Suter.
Hello, my name is Wesley Suter. As our host, Dwight Brothers, mentioned earlier, the old approach to nothing by mouth before surgery had its roots in the idea that prolonged fasting would reduce the risk to the patient postoperatively associated with aspirations and what have you. However, we know that no longer to be true with new evidence-based practice from our Aussie mates in the land down under, specifically the Joanna Briggs Institute. They have found that there is no increased risk to the patient if they continued clear liquids up to 2 hours preoperatively. So what was the purpose of this new evidence-based practice or new research? The purpose was to have a safer postoperative patient and fewer complications. So what I mean is a more hemodynamically stable patient, fewer complications to dehydration, as you can imagine with increased fluids, and a better overall glucose control or serum glucose control postoperatively. This new approach has its focus or its idea in the holistic approach of the patient, putting them in the forefront of the idea behind this movement, making the patient more comfortable with the preoperative criteria, which is going to lead to better adherence, that they're going to meet that criteria and not lead to more delays in the OR or cancellations, which we know will back up everything in the hospital. So yeah, physicians have embraced this. It is a slow-moving thing. It's not implemented in all hospitals, but maybe in the next couple of years or so, it may be common practice. So I just want to thank you guys for having me. Dwight, Dominic, I'll catch you guys again in the future. Signing off.
Thanks for having me, Dwight. Wes, always a pleasure seeing you, friend and colleague. I'd love to see that we're using a patient-centered approach to evidence-based practice. With that being said, these populations are only going to be, this is only going to be for a population that's going to be healthy and going into elective surgery. So this is going to be contraindicated in patients that are obese, that have diabetes, or a history of hiatal hernias, GERD, bowel obstructions. And I love the evidence-based practice approach that they're doing because it's going to be, the number of hours are going to be decreased with an 8-6-4-2 approach of how much food you can take in. With 8 being your biggest meal, what you would normally eat, to 6 hours would be a light meal of toast and clear liquids. And then if you're an infant, it's going to be a non-human formula. 4 hours is going to be breast milk for infants. And then 2 hours, which I love this the most, is that it's going to be for clear liquids, but it's going to go against clear liquids for the infants all the way up to geriatrics. So this whole approach is going to work for not only it's going to work for the whole spectrum of people, I should say. And your clear liquids are going to be the juice, the carbonated beverage, clear black tea, black coffee, and then sucrose for young infants that still need sugar. And this has shown that it's going to keep them at a good baseline as they go into surgery. What I'm most worried about, and I looked into and did some research, was the vulnerable population of mother and children. And I looked at a time series trial, and it showed that the mother and child had decreased anxiety when they were able to feed up until 2 hours prior to surgery. And then afterwards, it showed that the child had reduced pain, and the mother and child had reduced anxiety afterwards as well. So that's just showing that here we are moving in the right direction, and it's something that I'd love to see bump up to a level 1 and go a little bit forward. With that being said, we are headed in the right approach of this evidence-based practice. I want to see this being implemented, or I'd love to see this implemented in the hospitals or healthcare outpatient clinics that we have. We owe it to ourselves and also our patients to be up to date with everything that we do. And I'd love to see this become widespread, and obviously as we keep evolving, being able to implementing more and more to make our patients safe and have better outcomes in the surgeries that we do. Thank you.
All right, thanks Wes and Dom for that report, and thank you to our viewers for joining us tonight for Medline. We hope to see you next week. This is Dwight Brothers signing off for BUNS News. Good night.